September is National Suicide Awareness and Prevention Month, and on the forefront of tackling the public health problem of suicide is our local mental health authorities with trauma-informed initiatives to prevent suicides. Now, one of Central Texas's local mental health authorities is Central County's Services, which serves Bell, Coryell, Milam, Lampasas, and Hamilton counties. With us are two of CCS's staff who are on the forefront of suicide prevention. First, Felicia Burden. She is the Community Service Manager, and Paola McIntosh, the Associate Behavioral Health Director. Paola and Felicia, welcome.
Thank you.
You betcha. Now, a question for both of you here. What makes National Suicide Awareness and Prevention Month as important as it is?
Oh, Suicide Awareness Month is huge because it shines light on a topic that often remains hidden, mainly due to stigma or misunderstanding or simply lack of awareness. In the U.S. alone, we lose people to suicide every single year. The number is as high as 55,000 people every year. And in Texas, it's no better. Unfortunately, just last year, we recorded losing people to suicide, over 4,300 individuals. So the impact that it has, it's huge. For every one death, 135 individuals are affected.
That is a public health problem indeed. Now, Felicia, I understand you have a new grant-funded program to support survivors of suicide. What would you like viewers to know?
So I think the most important thing is this funding allows us to bring what's called a LOSS team to our communities, and LOSS stands for Local Outreach to Suicide Survivors. And it offers immediate support to families and peer support. Someone to be able to come in and say, I've been where you are and I know how to get you through this. And then we also provide community education with free trainings to bring awareness and support to the community.
A very important thing indeed. Now, Paola, I understand you're involved with Central County Services Zero Suicide Initiatives as well. What's all involved in this ongoing effort that you're involved with?
Well, let me tell you very briefly what it is. It's a preventive approach that we have adapted for us to provide services. So what this means is like we provide screenings to identify individuals at high risk. We train our staff, not only our clinical team, but everyone, so they feel a little bit more equipped handling conversations regarding suicide. We have caring contact cards, which is the aftercare after someone is being hospitalized, because that period is like critical. It's a small gesture, but it shows that it reduces the risk drastically of suicide.
And that's so desperately needed right now. What are some resources that are available through your initiatives?
So the big piece for the post-vention side is providing survivors with those aftercare resources. So not only the emotional support of grief support, peer support, but the more practical things that they might need in the aftermath of a loss. And then on the other side is our training initiative. So we provide free community trainings for mental health first aid, safety planning, Ask About Suicide, and the Columbia Suicide Severity Rating Scales.
That sounds positively wonderful. Lots of resources out there that people really may just not know about. Now, how can people contact you with your website and everything?
Yeah, so they can call the crisis hotline. That number is 800-888-4036. They call and they are prompted to press number 1, and they will be connected to a mental health professional. They can visit our website, centralcountyservices.org, where information on our services and our clinic locations and our operations are available. And then for LOSS team, they can email us at ccs.lossteam@ccs1967.org.
That is very, very thorough. I would imagine this is a year-round effort that you all do to make sure that you're on the forefront of this as we continue to have more of a safer conversation about this.
Exactly.
You got you. Okay. And one last question I have for you. It's been said in my experience with suicide prevention is that people don't necessarily want to die. They just want the pain to end. Can you elaborate a little more on that?
Yeah, a lot of the times, if we can provide that intervention and provide that support and wrap services around the individual, we can mitigate that outcry and eventually the death of an individual, because they feel hopeless in the moment. But if we can if we can catch them in the moment and stop it there, then we can potentially prevent that person from dying by suicide.
It's one at a time. Thank you so much. Felicia, thank you so much. Paola, thank you. Paola McIntosh, Felicia, last name one more time?
Burden.
Burden. I wanted to make sure I was thinking Birdwell. I was thinking of something else, but thank you so much for this.
Thank you for having
It's
us.
been an honor to have you here. Thank you so much.
Thank you.
Thank you.